My name is Roseanna, and I'm going to give you a short tutorial on how to write a written SOAP note when you become a medical assistant. First, I am going to show you what goes in each section of a written SOAP note. Then I will write one out to give you an example of what a written SOAP note should look like when it is done. The MA does the first two parts and the doctor does the last two parts. But I am going to fully write one out as if the MA and the doctor did one, so you will know what it looks like. This is what goes in each section of a SOAP note. Subjective. Subjective is what the patient tells you and the patient history. Objective. Objective is what you observe and anything you do for the patient. Example, draw blood, injections, exams, etc. Assessment. Assessment is the diagnosis. The doctor will do this part. Plan. The plan is any meds or treatments the doctor prescribes for the patient. All education, instructions on how and when to take the medication, any follow-up appointments, date, and time. The doctor will prescribe the meds, and the front office will do the follow-up appointments. Notice how I abbreviated some words. In the medical field, especially MA, you will abbreviate a lot, depending on the office you work in. But it is always good to know how, just in case. Now I am going to show you a fully written SOAP note and exactly what you might see in a medical office as an MA. This is my SOAP note. You will find the patient's name, date of birth, date, and any other personal information needed that belongs on a SOAP note. For my SOAP note that I made, I did a female. Her name is Kathy DeJesus. For her CC, which means chief complaint, it is pain in abdomen and foul-smelling urine. Every SOAP note has a chief complaint. The chief complaint is the main thing the person complains about. Now starting with the S in my SOAP note. Subjective. 16-year-old female complains of pain in lower abdomen, dark foul-smelling urine when urinating. Bleeding between menstrual cycles times 2 weeks ago, meaning all this happened starting 2 weeks ago, and symptoms still persist. Patient states it is very painful and feels like kidney stones. Always put in quotations what the patient says it feels like. 8 out of 10 on pain scale, meaning on a pain scale of 1 to 10, it's 8. 0 radiation, meaning the pain does not move. It just stays in the same spot. Patient said they had unprotected intercourse times 1 month ago. Because of the patient's symptoms, this is asked so we know where her diagnosis may have came from. Taken 0 meds. We would also like to know any medications the patient is taking. Do you see how I put everything the patient told me from what they feel to anything they have done or taken to try and cure it? The S in a SOAP note is basically called liquor, AAA, and PAM. Liquor. L is for location, where is the pain or the discomfort. I is for intensity, pain scale 1 to 10, 10 being the highest. Q is for quality. What does it feel like? Explain. This is where I told you in a SOAP note, in the S, the patient states, and you put it in quotation marks in the patient's exact words. O is for onset. Was it sudden? Did it suddenly happen? Or did it happen later on? When did it happen? What were you doing when it happened? R is for radiation. Does the pain or discomfort move from one spot to another? AAA. A, associated symptoms. A, alleviating factors. What makes the symptoms feel better? Any medications, any aspirins that you're taking? A, aggravating factors. What makes the symptoms worse? A certain way the patient lays or sits? Anything. Anything that makes the symptoms worse. PAM. P, past medical history. A, allergies. Any allergies the patient may have. M, meds. Any medications the patient is taking. Now for my objective in my SOAP note. UA at 12:35 p.m., which is a urinalysis. NAAT at 12:45 p.m., which is a nucleic acid amplification test. DFA at 1 o'clock p.m., which is a direct fluorescent antibody test. A bacterial CNS, which is a culture and sensitivity test at 1:30 p.m. Their blood pressure is 128/60. Their temperature is 96.8. Their pulse is 72, and their respiration is 30. The O In the O, this is any specific test I have done on the patient that the doctor ordered to be done and the exact time of the test. The tests the doctor orders are to help the doctor diagnose the patient with the right diagnosis. And my vital signs go in the O too.
Go.
Now for the A in my SOAP note, assessment, rule out UTI, which is a urinary tract infection. Because the tests are not back from the lab yet due to how long they take, the doctor will rule out what he knows is not the issue. So in this case, he ruled out UTI, just from the symptoms the patient is having. He knows it is not a UTI. Now for the P in my SOAP note. Plan. The doctor ordered the patient doxycycline, 100 milligram tablet by mouth 2 times a day times 1 week, meaning the patient has to take it for a week. 2, follow-up appointment in 2 weeks if the symptoms persist or progress, meaning if the patient still has symptoms or they get worse. The plan is what the doctor came up with to cure the patient's symptoms they are having. As you see, he prescribed a medication for a certain amount of time to see if it will cure what he believes may be wrong with the patient. But since he's not 100% sure, he didn't diagnose them with it. Other than what the doctor has for his plan in the SOAP note, he knows there is not much more he can do for the time being. So he wants her to make a follow-up appointment only if the symptoms still appear or if the symptoms are getting worse. So she would follow up in 2 weeks if needed. In other cases, a follow-up may be needed before leaving the doctor's office. This is basically a SOAP note and how to do one. There are other things that could be added in a SOAP note, but they all depend on what the patient complains of. Here are some other things to be asked during a SOAP note if needed to be asked. This is called FOSS and HUG. FOSS and HUG. FOSS, F, family medical history. O, OBGYN issues. S, social history. S, sexual history. HUG, H, hospitalizations. U, urinary issues. G, gastro issues. These questions are asked if they have anything to do with what the patient is complaining about. So this is what a written SOAP note looks like. I, the MA, did my part and the doctor did his part. Now the patient is all ready to be released to get their follow-up appointment if needed. Well, that's all for today. Hope you learned a lot from this brief tutorial on how to write a written SOAP note. Thanks for watching. Bye.